So your approach seems to really look at insulin response. It's looking at obviously the IGF-1, mTOR, things that are dietary, nutritional factors that are influencing those pathways, and then of course the rest being fat. For me, I like to think about food as what you're putting in your body, not only to activate these pathways or try to keep the pathways from being too active, but also I like to think about it at the level of the gut, because the gut, one, regulates the immune system big time. I mean, that's, you've got more immune cells in your gut than you do in any other organ in your body, and your gut bacteria, the interaction between your gut bacteria and your gut are also regulating the types of immune cells that you're making, regulatory T cells being put in that. And also because it's the major source of inflammation, and inflammation, even very recently, has been identified to be a driver of the aging process. So, eating things that are good for your gut, like fiber, and avoiding things that are going to cause a lot of gut damage. So I think about those things as well. And then micronutrients, which is also very important. Micronutrients are cofactors for a variety of enzymes and proteins in the body to make sure they're, functioning proteins that are involved in, these processes we're talking about, keeping cancer cells in check, P53 is zinc-dependent proteins. Magnesium, which is important for repairing damage, things like that. Are those things that you consider at all when you're thinking about the influence of diet on the aging process?
I don't think about it as much as a lot of people do, and I would hate to use the term I'm a gut skeptic, because I think that conjures up a whole bunch of negative images. But so I'm going to be a late adopter on this one, right? So there are a whole bunch of facts that everybody can rattle off about the gut. A lot of them, by the way, are kind of BS. So the cells in the gut outnumber the cells in our body 10 to 1. That actually turns out to be false.
So you mean bacterial cells?
Yeah, sorry, the bacterial cells versus, the bacterial cells within our gut. So putting all that stuff aside, there are a whole bunch of really interesting facts.
Yes.
But it reminds me of, what a good friend of mine once told me when I was trying to rationalize something I needed to do or thought I needed to do to him. He said, "Why are you doing this?" And I said, blah, 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 blah. And he said, "That's a fact, but is it a reason?" And so that's kind of how I feel a little bit about the gut. Like, there's a whole bunch of really interesting stuff, but I don't know that it actually matters that much, right? It's like, I'll give you a sort of a really idiotic example. The number of ants on this earth outnumber us 10 to 1. I'm making that up. Ergo, we should be doing more to protect the ants by avoiding climate change.
Yeah,
and I'm saying, no, that might be true. There might be more ants than us. And,
yes.
But we're the species of interest. So the point is, so that's my first sort of kind of lack of interest. The second is I don't really know what to do with it, right? So I've been through it all. I've gone through all the sequencing. I've done it with patients. And I have found that it's like there's a very crude set of tools that I can use in really obvious cases. So I had a patient that came to me 2 years ago who had a history of sinusitis, horrible history of sinusitis. So she probably had to do an Augmentin course 6 times a year because of recurrent sinusitis. She had 3 surgical procedures, just couldn't get better. So started working with her, became pretty clear to me that there was something in her diet that was creating an inflammatory environment that wasn't a structural problem. So we made a lot of dietary changes, things got better, but in parallel to that, I sort of suspected that 10 years of 6 cycles of Augmentin probably altered her gut. And so, she's an example of someone where I would do, a sequence and look and be like, lo and behold, you're all yeast, right? Not surprisingly, and disproportionate bacterial overgrowth. Okay, so she's an example of someone in whom the signal was so big that I felt like there was an intervention I could make, which was both fixing her diet, but also utilizing agents that could alter that. But for the most part, I don't have a clue what to do. And all the people I see who claim to know what they do, they can't convince me that they're knowing what they're doing. Now, that doesn't mean that you can't, I'm talking outside of a couple of really amazing examples. So we're familiar with how C. diff colitis works and the reversal of C. diff with stool transplant. So those are remarkable examples. But some of the other stuff I'm still not clear of. So I guess what I'm saying is I'm happy to be convinced, but I'm not convinced yet that this is that this is a reason and not just a fact. So
I think that focusing on the gut microbiome and the number of bacterial cells that supposedly outnumber our human cells and all that, I don't think that's the important point. So I've become very interested in the gut, mostly because of a colleague of mine, Mark Shiganaga, who's been doing gut research at Children's Hospital in Oakland, and is brilliant. He's been, showing me data, and I've just been convinced more and more that gut health, making sure that you're keeping the mucin, which your gut goblet cells are producing, that disgustingly slimy mucus-like material that's keeping and separating the immune cells in your gut from all the microorganisms in your gut. And that's very important because when that starts to break down, the immune cells recognize bacteria and they start
and I'm not asking this rhetorically, I just don't know. Yes. Is there an effective way to diagnose that in patients?
So the problem is that endotoxin release into the blood system would be the way to measure it and to diagnose.
So you could measure it through the lack of barrier, basically.
You can measure the endotoxin levels in someone's blood, which is a marker or a proxy
of the throughput. Yeah.
But the problem is that getting that there's also a lot of false positives.
That's right. Yeah.
So that's the only concern until that test, that diagnostic test, can be
because
refined.
It seems to me a stool test would be a more effective way to measure that.
Endotoxin or mucin?
Mucin.
Yeah, there might be a way to do that, to measure it in a stool. Yeah. That would be an interesting thing to explore because so what I'm getting at here is I'm also I'm a scientist. You obviously are a scientist and like to understand mechanism and see solid data before you think something is true. And I have become more convinced that that endotoxin released from the gut, which is a constant, really the major source of inflammation in the body is
and to be clear, Rhonda, I'm not disputing that. So to be clear, I bought that thesis back actually when I was a surgical resident because we would see endotoxemia.
Yeah.
Right. Surgical procedure gone bad, endotoxemia, ICU, death. I know what that looks like in its most extreme state. What I think I'm more of a skeptic of, and again, a skeptic waiting to be convinced, is that I can intervene that I can make that diagnosis in a non-catastrophic case, which is basically the chronic case, and make an intervention, either through some alteration in the microbiome itself, or meaning directly or indirectly through diet or other variables. So, and I think that will be a very interesting sort of path to go down. But again, I'm trying. There's so many things I don't know at the moment. I'm just trying to focus on the ones I do know.
Yeah. There is some interesting work coming out of like Justin and Erica Sonnenberg lab over at Stanford. I recently had a discussion with them on looking at the role of fiber and certain types of fiber in fueling different species of bacteria in the gut and how those are generating short-chain fatty acids and other signaling molecules which are regulating hematopoiesis, they're regulating, the number of Tregs that we're making. So it is very interesting that feeding our gut certain types of fiber, which are present in vegetables and a variety of, fruits even, do have a positive effect on the immune system via these signaling molecules that are being made in the gut. That's very interesting. And it is one thing that I consider when I'm thinking about the effects of diet on longevity, because I think that while I've focused on insulin for a long time, I've been very interested in insulin. When I first I was doing research at the Salk Institute in La Jolla. Before I went to graduate school, I was working on aging, and specifically doing different genetic manipulations in C. elegans to look at the effects on aging. So insulin signaling was obvious. Decrease insulin signaling, you're going to increase this worm's lifespan by up to 100%, which is very profound. So I've been very focused on insulin for a long time and reducing the insulin signaling pathway, reducing the insulin response, all that. However, I think that as I continue to look in humans and we're very, complex organisms, and there's lots of interactions between things going on, between different things that are happening in our diet, in our lifestyle, that are affecting the way we age. And one of those I do think is gut health. I sort of began to become interested in what sort of diet is good for my gut and what is not good for my gut. And I think we were talking a little bit about this before before we started filming this, and that is one thing I'm also very interested in is the effects of fat on the gut, because fat can be very hard on the gut. But I think that it also depends on a variety of factors. If you're eating it with protein, if you're, if you already have, an unhealthy gut, if you're not exercising or you are exercising, things like that. Also, genetic factors play a very important role. Certain polymorphisms